Plavix clopidogrel is used to prevent heart attack and strokes in persons with heart disease, recent heart attack, recent stroke, or blood circulation disease, peripheral vascular disease. It is also used with aspirin to treat new worsening chest pain, new heart attack, unstable angina, and to keep blood vessels open and prevent blood clots after certain procedures, such as cardiac stent. Clopidogrel works by blocking platelets from sticking together and prevents them from forming harmful clots. It is an antiplatelet drug, which helps keep blood flowing smoothly in your body. How to use. Always take this medicine exactly as your doctor or pharmacist has told you. Check with your doctor or pharmacist if you are not sure. The recommended dose, including for patients with a condition called atrial fibrillation and irregular heartbeat, is 175 mg tablet of Plavix per day to be taken orally with or without food and at the same time each day. If you have experienced severe chest pain, unstable angina or heart attack, your doctor may give you 300 mg or 600 mg of Plavix, 1 or 2 tablets of 300 mg, or 4 or 8 tablets of 75 mg, once at the start of treatment. Then the recommended dose is 175 mg tablet of Plavix per day, as described above. If you have experienced symptoms of a stroke which go away within a short period of time, also known as transient ischemic attack, or an ischemic stroke mild in severity, your doctor may give you 300 mg of Plavix, 1 tablet of 300 mg, or 4 tablets of 75 mg once at the start of treatment. Then the recommended dose is 175 mg tablet of Plavix per day, as described above, with acetylsalicylic acid for 3 weeks. Then the physician would prescribe either Plavix alone or acetylsalicylic acid alone. You should take Plavix for as long as your doctor continues to prescribe it. Contraindications. Plavix is contraindicated in patients with active pathological bleeding, such as peptic ulcer or intracranial hemorrhage. Plavix is contraindicated in patients with hypersensitivity, e.g. anaphylaxis to clopidogrel or any component of the product. Warnings. Plavix keeps your blood from coagulating clotting to prevent unwanted blood clots that can occur with certain heart or blood vessel conditions. Because of this drug action, Plavix can make it easier for you to bleed, even from a minor injury. You should not use this medicine if you have any active bleeding, such as stomach ulcer or bleeding in the brain. Plavix increases your risk of bleeding, which can be severe or life-threatening. Call a doctor or seek emergency medical attention if you have bleeding that will not stop, if you have blood in your urine, black or bloody stools, or if you cough up blood or vomit that looks like coffee grounds. What to avoid? Avoid alcohol, it can increase your risk of stomach bleeding. Avoid activities that may increase your risk of bleeding or injury. Avoid activities that may increase your risk of bleeding or injury. Use extra care to prevent bleeding while shaving or brushing your teeth. If you also take aspirin, ask a doctor or pharmacist before using medicines for pain, fever, swelling, or cold flu symptoms. They may contain ingredients similar to aspirin, such as salicylates, ibuprofen, ketoprofen, or naproxen. Taking these products together can increase your risk of bleeding. Possible side effects. Like all medicines, this medicine can cause side effects, although not everybody gets them. Contact a doctor immediately if you experienced fever, signs of infection, or extreme tiredness. This may be due to a rare decrease of some blood cells. Signs of liver problems, such as yellowing of the skin and or the eyes, jaundice, whether or not associated with bleeding which appears under the skin, as red pinpoint dots and or confusion. Swelling in the mouth or skin disorders such as rash and itching, blisters of the skin. This may be signs of an allergic reaction. The most common side effects reported with Plavix is bleeding. Bleeding may occur as bleeding in the stomach or bowels, bruising, hematoma, unusual bleeding or bruising under the skin, nosebleed, blood in the urine. In a small number of cases, bleeding in the eyes, inside the head, the lung or the joints has also been reported.